And there's a warning tonight for men taking those popular erectile dysfunction drugs.
They may increase your risk of developing a deadly form of skin cancer. CBS 2's Dr. Max Gomez is here now to explain this development. Dr. Max?
That's right, Christine and Dana. Malignant melanoma is lethal if it's not caught at a very early stage. And it's increasing at the greatest rate in men over 50, the very group most likely to be using erectile dysfunction or ED drugs such as Viagra. That's why this association between melanoma and ED drugs is worrisome. It is the little blue pill that has transformed many a love life. Viagra is the first and still most prescribed erectile dysfunction drug worldwide. But for the untold millions of men who have used Viagra, there's now a link to a serious skin cancer.
The people who were taking Viagra were at an increased risk for melanoma-type skin cancer.
That disturbing link comes from a large study in JAMA Internal Medicine that followed nearly 26,000 men who had used Viagra at least once since the study began in 2000. It found that those men had about an 84% greater risk of developing melanoma than men who had not used Viagra.
If it really translated into real life, then it might be as much as one extra melanoma for every 1,000 men per year.
What makes this association biologically plausible is that cancer researchers have shown that melanoma growth is promoted by a biochemical pathway that is also affected by Viagra. In fact, in the lab, Viagra can actually make melanoma more aggressive, but the drug does not seem to affect other types of skin cancer. But Dr. Alan Halpern, the chief of the dermatology service at Memorial Sloan Kettering Cancer Center, agrees with the study authors that these preliminary findings should not yet change the prescription of Viagra. Rather,
it may mean that doctors who are prescribing Viagra can take the opportunity to A, check their patient's skin, and at a minimum, ask the question whether or not they've noticed any new or changing dark spots on their skin.
the study only looked at and asked about Viagra because at the time the study started, that was the only approved ED drug. But Dr. Halpern says that the other ED drugs, Cialis and Levitra, work on the same biochemistry and may pose an even greater risk for melanoma because they are longer lasting in the body than Viagra.